Hi, welcome to Do This, Not That. I'm Sue Self, licensed clinical social worker and behavioral health liaison manager for BJC Behavioral Health. In this segment, we're trying to understand and feel confident and competent when providing care for patients who experience anxiety.
Help! Michelle, tell me what's going on. My chest, I'm so hot, I can't breathe.
Anxiety is a feeling of fear, worry, apprehension, nervousness, or unease, typically about a stressful situation, an imminent event, or an uncertainty. It's important to look at this as an actual problem. While we can't see what's actually going on, something very scary for them is. Treating it as such is the only way to help.
I know you're really scared, okay? I'm here to help you. I know you're frightened, but we're gonna work through this, okay?
Anxiety can have many physical symptoms, and because of this, it can be mistaken for a medical illness. Patients might visit many doctors and make numerous trips to the hospital before their anxiety disorder is diagnosed. You could see the patient feeling unreal or detached from his or her surroundings. A fear of dying, losing control, or going crazy.
I'm gonna die.
Feelings of apprehension or dread. Trouble concentrating. Feeling tense and jumpy. Feeling like her mind's gone blank. Some patients might also complain about heart palpitations or chest pain, hot or cold flashes or sweating, shortness of breath or hyperventilation, numbness or tingling sensations, dizziness or feeling faint, frequent urination or diarrhea, nausea, muscle tension or headaches, tremors and twitches or shaking, and fatigue. Anxiety can protect us from dangers. It's a natural response to fear. But when anxiety is constant or overwhelming, when it interferes with relationships and activities, it stops being functional. It's irrational, excessive, and out of proportion to the actual threat or danger the situation poses. A panic or anxiety attack is a sudden surge of overwhelming anxiety and fear, which peaks in about 10 minutes and usually lasts around 20. They can occur for no apparent reason. So what's going on here? What causes this? Although the exact causes are unclear, life experiences such as traumatic events can trigger anxiety disorders in people who are already prone to becoming anxious. In a panic attack, certain hormones are released from the adrenal glands and dumped into the bloodstream. The brain cannot distinguish the difference between real danger and one that's in the mind. Medications and medical conditions can cause anxiety, such as pregnancy, Alzheimer's disease, any heart issue, hyperthyroidism, hypoglycemia, stimulant use, medication withdrawal, urinary tract infections, or hormone changes. What actions should a healthcare worker take? First, rule out a medical cause. If a patient is in the midst of an attack, find out what symptoms the patient is experiencing. Try to comfort them by letting them know you're there to help. Remove the cause or take the patient to an open and calm area. Keep the patient cool. Patients can experience warmth around the neck and face. A wet washcloth can help. Ask, are you reacting to what's going on now or to something else? Ask the patient to remain still, but if she doesn't or can't, don't think of it as non-compliance. It's adrenaline. Wait it out. The episode will pass. Panic attacks tend to peak around 10 minutes and get better from there. An agitated patient who is unable to engage in any conversation and or may be on the edge of new or repeated violence requires vastly different management than a person who may be willing and able to engage. This type of behavior is covered in a separate module. After an attack, teach the patient ways to manage their anxiety. Breathing exercises, muscle relaxation, or self-soothing visualizations can help. Communicate with the physician about the anxiety attack. Follow up with reassurance and encourage the patient to seek help after discharge. Don't dismiss their fears. Saying things like there's nothing to worry about or it's all in your mind will only exacerbate the problem. Don't pressure the patient. This is not the time to force the individual to come up with answers or do things that will make their anxiety worse. Don't leave the patient alone. Stay with them until they have recovered from the attack. Never grab, hold, or even gently restrain a panicking patient. Do ensure the safety of the patient, staff, and others in the area. Be directive and empathetic. Understand what they're going through. Speak calmly in a reassuring but firm manner with a lower pitch, volume, and rate. Help the patient manage her emotions and distress and maintain or regain control of her behavior.
Help! I'm having a heart attack! I can't breathe, I'm gonna die, help me!
I'm here to help. Your vital signs are good, and the EKG we did just a few minutes ago is normal.
Help!
Michelle, tell me what's going on with you.
My chest, I'm so hot, I can't breathe!
You can't breathe. You're sweating and you're shaking all over.
Help me!
Are your fingers tingling?
Yes!
Okay, I can help you. You're not going to die, even though I'm sure it feels that way, okay? Look at me, look at me. It looks like you might be having some anxiety. Has this happened to you before? Okay, are you reacting to what's going on right now or something else?
I don't know.
Okay, it's okay, I understand. What I want you to do is we're going to take a few deep breaths, okay? I want you to try to lean back, try and relax. I want you to follow along with me, okay? Do what I ask you to do. Look right at me, Michelle. Focus on my face, okay? I'm going to count 1 and 2. I want you to take a deep breath in, and then I'm going to have you blow out. We're going to try and slow your breathing down, okay? Look at me, look at me. Deep breath in. 1, 2. Inhale. Slowly exhale. 1, 2. In and out. Slow it down. Ready? 1, 2. Good. Again, slow it down. I want you to say this little saying with me. This is anxiety.
This is anxiety.
This will pass.
This will pass.
This is anxiety.
This is anxiety.
This will pass.
This will pass.
This is anxiety. This will pass.
This will pass.
Okay.
This is anxiety.
This is anxiety. This will pass.
This will pass.
Good. Good job. Are you better?
Yes, thank you.
You seem a lot better now. What about your chest pain?
My heart's still pounding a little bit, but my chest feels a lot better.
I noticed that you're breathing easier now too. You can practice that breathing exercise anytime so you can use it when you need it.
Do you think I was having an anxiety attack?
Well, we'll consider all the possibilities that might cause this, but it could be. Tell me what's been going on with you. Are you worried about the procedure tomorrow?
Yes. When the doctor came in and started talking about all the risks involved, it kind of got my brain going.
Some important points to remember are: a panic attack can occur even though there's no trigger present. Patients can become distressed and frightened by the attacks. See him or her as a real person, not as a disorder. A panic attack on its own is not life-threatening. Patients need reassurance, compassion, and someone to help them through it. Remember to stay calm and act quickly, something you already know how to do. Keep in mind that you don't need to be a psychiatric professional to help a person through this kind of difficulty. You just need to know what to do. Thanks for watching.